I'm Dr. Jennifer Scott. I grew up in Orlando, Florida, and went to med school at the Medical University of South Carolina. I also did my grad school there. And then I moved to DC to study dermatology and internal medicine at Georgetown University. And then I did my fellowship in Pennsylvania at Hershey Medical Center in Hershey, Pennsylvania in dermatopathology. I love working at Ada West Dermatology because everybody here is so kind, so helpful. Everybody just wants to do the best for the patients here. I can reach out to any of the physicians or physician assistants here and ask for help with things, and everybody's just very willing to help, and everybody has a single goal. I think one thing that's good for patients to be aware of is sometimes it's really good once you find that dermatologist you like, you have good rapport with, to stick with them, because once we see you the first time and get to know your moles, get to know your rashes, what works for you, what doesn't work for you, we can build on that over time. So it's kind of it's like a relationship that's long term, and the longer you know somebody, the better you know somebody, the better you're going to be able to take care of them. So when you're looking for a dermatologist, there's some basic things. You want to make sure they're board certified. You want to make sure that they keep up with the current literature, they're interested in always learning more, because there's new stuff we can use to treat patients like every day. And after that, I think it's important to find a dermatologist that you just feel comfortable with. Like, you know, when you're in our exam rooms, a lot of times we're seeing skin that you don't necessarily show everyone else. And then you're, you know, talking to us about issues you wouldn't feel comfortable talking to just anybody about. So you need to feel like that dermatologist can hold space for you so you can talk and feel comfortable with them so you can get the best care. You know, I've never really been somebody to be like in a hurry to get to some goal, which I think is helpful in medicine because there's a lot of goals in there and you kind of have to enjoy the journey. And the other thing about me is like you know, things don't always go your way, and some things are hard in medicine, and sometimes you get very sad about them. But somehow I've managed to still get up every day and do this job and be happy about it. So I guess resilience is the word for that. So I'm a person of many hobbies. I have lots and lots of hobbies. I don't do them all at the same time, but I've done lots of things over the years. Like I like to paint. Music's always been a big part of my life. I played the flute. That was a very big part of my life. I was in college to be a music major. And I also played the piano. I don't play the flute anymore, but I from time to time will play the piano again, and I want to like bring that up as my next hobby that I do. Otherwise, I like to do like a lot of active things. Now that I've moved to Idaho, I decided to become a skier in adulthood, which is very hard, but I've been really enjoying that. So my skincare routine, it's pretty simple. I look for like certain active ingredients in the products I use because there's a lot of stuff out there and people will try to sell you anything. So sunscreen is number one every day, without a doubt. There will be sunscreen on me. Then after that, sometimes I use a vitamin C in the morning or a niacinamide. Those are really good products for the skin, but those are plus or minus depending on how I'm feeling, how much time I have. And then at night I use a tretinoin. Well, my favorite sunscreen is the tinted Tizo sunscreen. It's very nice and moisturizing for people with dry skin. I think my favorite vitamin C is the Vanny Cream vitamin C. It comes in like a nice little container. It's a good compound. I like it. Vitamin C is kind of like the next step of your skincare routine after you have your retinoid and your sunscreen. It is an antioxidant. So it's good to put on in the morning before you put on your sunscreen to help like amplify the effects of your sunscreen. It also helps with dark marks a little bit. So niacinamide's a nice compound. It's like an active ingredient. You'll see it in lots of skincare products these days. It's good for hyperpigmentation. That's why I use it. I like it for that. My favorite lip sunscreen is the Coola lip sunscreen. You can get it in tinted, or you can get it in like a clear version of it. I actually use it while skiing so I don't get a lip sunburn. So I've had lots of role models throughout the year. I had great role models in graduate school and in medical school. Then like I got new role models in residency. So I guess I'll start with like my most recent role model in fellowship. So my program director, and who's in charge of like all the derm path, he's just, you know, we'd have these, we'd be signing out, and then we'd have this break where we were like on Google Scholar, just searching anything and everything on Google Scholar to like help us with our cases. And, you know, he's been doing derm path for 30 something years, but we would stop for a good 30 minutes and just research what's new, what can help us make the best diagnosis. And I think like having that like level of interest and curiosity in your job is really like a lovely thing to have. He's also a very kind person, so nice person to work with.